Institutional conflict. I work for an inpatient state psychiatric hospital. A conflict that I've seen many different times is one involving staffing shortages. The hospital policy states that we must have a certain number of staff per a specific number of patients. On each of the 3 shifts, the recommendation of staff is to have 8 technicians per each 27 patient unit. The healthcare technicians can cover only up to 5 patients per individual, according to hospital policy. During the pandemic, there has been a significant staffing shortage. Because of that shortage, staffing numbers have been reduced to 4 healthcare technicians per unit, per shift. This reduction now forces healthcare techs to cover 6 to 7 patients apiece. While this mandate has been put in place, hospital policy has not changed. Now people are asked to do something that is technically breaking hospital policy. Also, because of this shortage, staff sometimes don't get their lunch breaks because if a patient becomes physically aggressive, that patient is assigned to a single staff. That increases the number of patients that the other technicians would have to care for. Employees are increasingly frustrated with the changes. Administration only communicates via email that they're doing everything they can to be helpful, but no individual comes to the physical patient care areas to assess the needs firsthand. Because of the growing conflict, many staff have resigned or have become physically ill due to stress and exhaustion. There are 2 sides to this conflict. The first is that administration believes they're making changes to help the units. The second being staff feels administration would rather have them work understaffed rather than hiring more help. This conflict is hard to resolve because there's no platform where both sides come together to talk about any issues. This scenario is an example of dysfunctional institutional conflict. We know conflict is inescapable through most organizations. We also recognize that some disputes can be suitable for organizations. People grow and learn from various kinds of issues as long as the conflict is not dysfunctional. The difficult task for managers is to choose a resolution strategy pertinent to the situation of the people involved. There are numerous causes of conflicts within organizations. The first is poor communication. Every workplace relies on communication to get tasks done quickly and successfully. The second is misunderstandings, particularly regarding policies and practices. Businesses often have too many procedures and regulations that are misinterpreted or abused. The last is personal differences. Individuals may disagree or engage in conflict for cultural, religious, or other demographic reasons. The role of functional conflict in institutional change can be a positive conflict for an organization. It endorses an intense exchange of thoughts, clears the air, and stimulates creative thinking, encouraging better choices and enhancing decision making. For example, a company may send out surveys for employees to complete on various improvements for the organization. Individual employees will voice their opinion, which can lead to positive changes for the company promoting institutional change. Dysfunctional conflicts can be unhealthy. With extended effects, it can impede the performance of the organization. Dysfunctional strife leads to a decline in communication or the performance of a group. Dysfunctional conflict within an organization generally emerges out of egos of the employees with competing ambitions. Sometimes it comes from misinterpretation or extreme changes in organizational structure without practical input from all areas. Higher degrees of stress and employees burnout are the usual outcomes. One strategy for resolving functional conflict is to rotate different members in the organization where possible. By rotating from one group to another, employees understand other members' point of view, values, and attitudes. Hence, communication is increased. When those are rotated are accepted by the receiving group, change in attitude as well as behavior become possible. This is undoubtedly a long-term technique as it takes time to develop a good interpersonal relations and understanding among group members. A strategy recommendation for dysfunctional conflict is the use of rules and regulations. Friction is reduced through the increasing details of rules, regulations, and procedures. This approach is known as the bureaucratic method. This method imposes solutions on groups from above. However, basic attitudes may not be modified. Let us remember that the best way for us to be proactive in conflict is to understand our own rules of interaction. Understanding that will help in conflict to improve situations, bring about change, and offer new solutions. Functional conflict can be healthy, constructive disagreement between groups or individuals, while dysfunctional conflict is unhealthy disagreement, and that occurs between individuals and groups also.